I am here again today with Bonny Specker. I know we did not have an update last week, so we are going to have an update this week. She is going to talk to us about vaccines and if they're working in some of those breakthrough cases and things that you may have been hearing about in the media, and also give us an update on everything that has been happening with COVID actually over the last 3 weeks since we did not meet last week. So Bonny, what do you have for us today?
Thanks, Chelsea. Yeah, I wanted to talk about the vaccines. A lot of people have emailed me wondering about why is it that people who are vaccinated are ending up in the hospital. Also, yesterday, the CDC came out with new recommendations, and I thought I'd just spend a few minutes going over that. As far as the weekly update, I'm going to go over a couple different slides that I haven't been going over regularly. They are part of that standard set of slides that you post on the city website, but I thought it would be interesting to look at some of those slides right now. As far as the hospitalizations, it's important to remember that vaccines are not 100% effective in preventing COVID. These mRNA vaccines, the Pfizer and Moderna ones, are very effective, far more effective than vaccines that we get for other things like measles and mumps, but it's not 100%. And if you look at the general population, these little dots are just representing some number of people. The red ones are people that are not vaccinated, and the green ones are people that are vaccinated. If a vaccine's not working, you would expect the same distribution of vaccinated people in those that are hospitalized as you have in the general population. So if 80% of the population's vaccinated, if you look at people that are hospitalized with COVID, you would expect 80% of them to be vaccinated if it wasn't working. But if a vaccine works, the percentage of the people hospitalized who are vaccinated is going to be less than the percent of people vaccinated in the general population. So these are what we are calling those breakthrough cases, but it doesn't mean that the vaccines don't work. They are working. They're just not 100% effective. And the higher the percent of the population that's vaccinated, the higher the percent of the people who are hospitalized that are vaccinated, you'll see. And I've tried to explain this here. This is from out of Public Health England, and I think they did a very good job of explaining this. And I'd like to just walk through it and then show you a few numbers. If you have 1 million people and 92% of them are fully vaccinated, so that's going to mean that 80% are not fully vaccinated. By fully vaccinated, I mean they're 2 weeks out after that second vaccine, that second Moderna or Pfizer vaccine, or 2 weeks out from the Johnson & Johnson vaccine. So if you have 92% of your population fully vaccinated, you have this 80,000 that are not vaccinated and 920,000 that are fully vaccinated. Now, let's assume there's a 2% chance of getting symptomatic COVID. And we have that here in both sides. And here, though, among the vaccinated people, we have 80% efficacy. Okay, so it's going to prevent 80% of the people from getting COVID if they're vaccinated, which means that 20% or 0.2 are going to come down with COVID. So if you take this 0.02, multiply it times 0.2, and then you multiply that times your 920,000, you're going to end up with 3,680 people that are infected with COVID. Over here, you just multiply this 0.02 times the 80, you end up with 1,600 people infected. And if you look at the percent of the cases, you can see that there's actually a large number of cases who have been vaccinated, but it's lower than that 92%, right? If the vaccine wasn't working, this would be 92%, and it's now dropped down to 70. Now, if you go the next step and look at hospitalizations, let's say there's a 10% chance of being hospitalized if you have COVID. If you go through the calculations down here among non-vaccinated, 160 of them would be admitted to the hospital. But over here, we've got 110 being admitted to the hospital. And it's like, whoa, that's not very different. But look at the numbers up here that you're starting with. This is 40% of the admissions, but 92% were fully vaccinated. So these numbers could look very similar, but it all depends on what percent of the population, your baseline, is actually vaccinated. And I think if people want to download this presentation and just look at this slide and think about what is happening at each step, I think it will make a lot of sense and help clarify, because I think it is confusing when they say, oh, 50% of the people that are hospitalized are vaccinated. Well, what does that mean? You don't know. If 50% of the population they came from were vaccinated, then something's really wrong. But if you've got 95% of the population vaccinated, 50% is not bad. So, you have to look at the whole picture. And here I just did some calculations using similar assumptions as in that previous slide, which was that you have a 2% chance of getting symptomatic COVID, that there's a 10% chance of being hospitalized with COVID if you're symptomatic, and that being fully vaccinated is 80% effective in preventing symptomatic COVID and 70% effective in preventing hospitalization, and 1 million people in the population. So exact same assumptions as that previous slide. Now, what if you have a population where no one's vaccinated? You're going to end up with 20,000 people who have symptomatic COVID based on these assumptions up here, and 2,000 of them are going to be hospitalized. We don't have any vaccinated people, so nobody's contributing numbers here. So you end up with this 20,000 cases, 2,000 hospitalizations. If 40% of the population is vaccinated, you're going to get 12,000 with symptomatic COVID out of the unvaccinated group, 1,200 hospitalized. But see, now here in the vaccinated group, we've got 1,600. That is, it's a large number, but it's a lot less if you look at the total numbers here. The symptomatic COVID is now dropped from 20,000 down to 13,600, and hospitalizations are almost halved by having 30% of the population vaccinated, or 40%. This 40% is close to what South Dakota currently is at. If we were to get that up to 80%, you can see what happens here in the final numbers. Again, we've had this final number of symptomatic COVID by about half, and we've reduced hospitalizations significantly down to about 500 hospitalizations. Now, this is just a simple, straight calculation, and what it doesn't take into account is that at these higher vaccination rates, the chance up here, this 2% chance of getting symptomatic COVID, will actually decrease because of that whole idea of herd immunity. The more the people that are vaccinated, the less likely you're going to have a spread. So this is a simplified version, and these numbers are probably higher than what you would actually see, given that this chance here will decrease. So hopefully that helps make sense. It's something that may require a little time to think about it and and go over it in your mind, but hopefully you can see that. As far as the new CDC recommendations, this is just a summary, and the recommendations along with this summary can be found on this website. And again, it came out yesterday. And the reason it came out is there's a lot of new evidence out about this Delta variant. And one of the big factors that resulted in these recommendations is the finding that people who are vaccinated have the ability to spread the virus if they're asymptomatic. You know, it's they're spreading it, the vaccinated people. And because of that, there's recommending now that people who are fully vaccinated should wear a mask in areas where there's substantial spread. And we'll talk about that a little bit later. But this is aimed at reducing the spread of the disease and protecting, so the people who are vaccinated, protecting their neighbors and their friends and their family. They're also saying that fully vaccinated people might choose to wear a mask regardless of whether it's substantial spread or not, particularly if they're immunocompromised or at increased risk of severe disease, or if they have someone in their household who they don't, who they really need to protect. Fully vaccinated people with a known exposure to someone with suspected or confirmed COVID should be tested 3 to 5 days after exposure. And that's again because they're finding that vaccinated people may not have symptoms, but they're able to spread the virus. So they're recommending that wearing a mask in indoor settings for 14 days. This is if they've had an exposure. And another recommendation that they came out is that all schools, this is K through 12, they're recommending universal indoor masking of all teachers, staff, students, and visitors to the school, regardless of their vaccination status. So that's actually probably one of their biggest recommendations, I would think, and whether that is followed, we'll see. Also on the CDC website, at this particular one, you can go to this link and you can actually see, this is Brookings County as of yesterday. Highlighted here, we're in moderate spread. And what the new recommendations are is that these counties that are red or orange, that they have indoor masking in indoor events. So, it's not bad if you're planning on traveling around the state, maybe look at this map and just see where the high transmission rates are. Now, as far as the weekly summary, this is as of yesterday, and just a reminder that the Department of Health is updating their dashboard once a week now. They update it on Wednesday, and it covers data through Tuesday afternoon. And the complete file for these data slides are available at this website. So this is Brookings County. We are in minimal spread this past week. The Department of Health has us in moderate spread because the Department of Health bases it on the average number of cases per week over the last 2 weeks. And last week we had 7 cases. So the average of the last 2 weeks is 4.5, and you have to have less than 4 cases to be a minimal spread. So it's minimal, but it's for this week. According to the Department of Health, we are in moderate spread at the moment, but we did have a reduction in the number of new cases this past week. As far as the state, we are increasing, and we've been increasing for a couple weeks here. And this past week we had 268 new cases. The week before was 200. If you zoom in on it, what you're seeing is a fairly large increase over the last month. And this is like, I think, close to 250% increase in 2 weeks. Hopefully that slows down, but this is what a lot of the graphs of the states that are now having substantial outbreak. This is sort of the beginning of what it looks like. Hopefully we can, stop that from continuing to increase, but this is not looking good at the state level. Hopefully we can slow it down. If you look at the hospitalization data for the state, this past week we had 33 people hospitalized. Actually, as of yesterday, 10 of them were in the ICU. And a week previous week, there were 30, 10 in the ICU. The hospital admissions for the last 2 weeks, it's about 10, so a little bit more than one a day. As far as deaths, we had 2 deaths this past week compared to 1 the week previous week. The 2 deaths in this past week that were reported, one was in a 30 to 39-year-old and one was in a 60 to 69-year-old. So the deaths, are moving to younger ages, mainly because we have such a high vaccination rate in those older age groups. So this is one of the slides that I don't normally present on this video, and it's just the percent of the population receiving at least 1 vaccine. An important thing to remember is that with the Delta variant, having just 1 vaccine of those mRNA only protects you about 30% efficacy. Having both vaccines really bumps that up. So this is not fully vaccinated, but it's the only data that the Department of Health actually reports on the dashboard. But if you see here, Pennington is at 37% of their total population that's vaccinated. This is Lawrence County. Brookings is at 44%, and Hughes is the highest at 54%. Now look at Lawrence and Pennington, and this is the cases per 100,000 over the past, since the beginning of July. And here in orange we have Pennington, and here in green we have Lawrence. They have the lowest vaccination rates and they're running at the highest number of cases per week. You see here that we have about 5 counties that have rates that are increasing fairly dramatically this past week. Brookings is this yellow line, so we were up looking like we were increasing, and then we dropped down, both Brookings and Davison. Beadle County has been staying pretty low, as has Brown County. But Coddington, a fairly large increase, Hughes County, Lawrence, and Pennington. It's interesting that Hughes County is increasing so much given they have the highest vaccination rate. But again, with this Delta variant, they're thinking that you need to be nearer to that 80% vaccination rate. And Hughes, isn't, even though they're the highest in the state, they don't have the highest or a high enough. And when I say highest in the state, I'm just referring to the counties with the 10 most populous cities, the ones that I actually report. The other thing I wanted to show, this is the mobility data for the state of South Dakota. I update this about once a month. This is in 2020. This is pre-epidemic, right? So this is back in February before it started. This is considered baseline. And you can see in March, when everything sort of shut down, we have big drops. If you look at the yellow and the white lines, the yellow is the average for everything but the white. The white is the percent of time spent in a household or in residence. And the yellow is the average spent in non-residential activities. So you can see it really dropped last March and then started returning to normal during the summer, dropping a little bit. And then November was when we had the really big outbreak where we lost so many lives. There you see that people returned to minimal mobility. You know, a lot more people were staying home. Now in 2021, we are now, you know, quite high. People are not staying home any more than they normally do, and their time spent in some of these other activities have really increased. So this graph is given in that data slides, and we also have a similar graph for Brookings County, if you're interested in that. This is the United States. Good news is that it has plateaued, or this week it looks like it's plateauing. We've had about 270,000 cases per week for the last 2 weeks. As far as the deaths, we're running at about 1,900 deaths per week, both this past week and the week before. If you know, it's a lot less than what it was back here, but this is still essentially equivalent to one jumbo jet crash per day. I mean, it's, you know, we've become so immune to some of these numbers. We have to remember that these are not small numbers. As far as worldwide, we're at 195 million cases. This is also looks like it's slowing down. We had 3.7 million cases last week and 3.6 million this week. And the number of deaths this past week globally also dropped. There's global data is difficult to get. This is from, you know, all the countries. Some countries have more up-to-date systems than others for reporting deaths. But we did drop. We're running about 65,000 deaths per week globally from COVID. So just in summary, you know, stay informed, pay attention to the CDC and WHO in terms of their recommendations. They are based on science. And I just, you know, science is not the evil party here. You know, it's the virus, and we need to pay attention to science. They're the one, you know, science is what knows viruses. Also be cautious of news obtained on social media. And just to emphasize the vaccines are working and that the risks of no vaccine are far greater than the risks associated with vaccines. And protect your family, friends, and neighbors, and follow public health recommendations. That's all for today.
Well, thank you, Bonnie. To those of you that are watching, just a reminder, I know we are only doing updates with video every 2 weeks, but these slides that Bonnie puts out are updated every week on the city website. So you can look at the information in the description of this video, and there is a link in there directly to that. So you can just click on it and go there. And also, if you have any questions, you can always reach out. We've included an email address. Just reach out. And if you have a question that you would like answered by an epidemiologist, we will try our best to answer that question for you in our next video update. Until not next week, but the week after, have a great time. Follow, you know, recommendations, and continue to look at the CDC website for their most up-to-date information.
Thanks.